has been brought to you by.
Did you know that the U.S. Constitution requires the government to count everyone living in the United States every 10 years? That our representation in Congress is determined by each of us showing up for our communities by counting ourselves? That this count determines funding allocations for programs we rely on, like school lunch, Head Start, healthcare, and housing assistance for the next 10 years? An undercount means less money from the federal government for vital services we use every day. It only takes a few minutes to complete. You can be counted online, over the phone, or by mail. Invitations to participate will be mailed in March. Make sure you and everyone in your household are counted. Our future depends on it. For more information, visit californiacensus.org.
And welcome to this special report, ONME News Review. We are live, and my name is Julia Najieb. I'm one of the hosts this evening, along with
Lennice Najieb.
Yes, I dragged you in here this evening.
Yes,
dragged you in here.
I know.
But we
there's a lot
had
that
to.
We have to go.
There's a lot that we got to talk about. And okay, well, if we screw up live, I guess that's okay too. Normally we do a pre-recorded podcast on this channel, but we are doing live. We figured making sure we do a courtesy to the public, you know, we have it going at least to the YouTube stream and also to the Facebook.
Yes, I've noticed this on the Facebook stream because this is one of those reports that's very highly important that we get the information out to our community and to a broader community of our perspective of what we see is going on out there in our version of what's happening with the COVID-19.
And we're going to talk about what that means because people think that this, some people might think that this just came along, but I know that someone sent me a picture of a Lysol can, and the Lysol can had the coronavirus on the back. People are like, well, why has it got that on the back? This, and you know us as a people. It's a conspiracy.
Yeah,
everything is a conspiracy.
Everything is a conspiracy with the government.
And maybe it is.
I don't believe it. I don't believe that people are dying and they looking at the rate of which a person dies, or they don't understand, so they're in a sheer panic.
Yeah. And there's a video we had even on our ONME News website. I think I should pull that one up. And it was one of the stories that that's a cool thing, I can just pull it up live here. And this was one of the things that we did we've been following the story. California-wide, all the black media has been following this. And I think that's what, this is such a big deal. And, you know, people are kind of nonchalant about it because we've seen the swine flu, you know, we've seen all kind of things, right? We've heard about and seen the swine flu.
You know, it's rumors that, you know, I was talking to a young gentleman earlier today, and he said to me, well, it's only for people your age. I'm like, my age? I'm like, I'm not that old. He said, well, it only affect the old people.
Oh,
and
so that makes it okay.
The older people are dying because they don't have the immune system to handle this disease right here. So if you're very, very old or you're very, very young, you're more susceptible of attracting this disease. That's the rumor that the young man just was sharing with me. And it's most likely I won't die from the coronavirus if I get it because I'm young and I have a healthy immune system.
Okay.
And most likely I had the coronavirus before because, you know, it's like a common flu or more or less like a flu virus. And I was listening, and I'm trying to understand why is he saying that? Where is he getting this information from?
Where are people getting the information from?
Well, I guess he claims he did his research, and he researched it all throughout Facebook, or all throughout the Internet, and this is what he came up with in his mind.
Okay. Well, here's the thing about YouTube and Google. You can get all kind of information, but it's all about the source of the information. I would recommend people actually first start with the California Department of Public Health. That's what we have up on the screen. And you can get to it by going to california.gov. Please take note. This is like the official site that's going to know the most up-to-date information. And it's going to give you all the updates happening California-wide. No more guessing. You people like to guess. Mm-hmm. And I'm going to show those pictures of the Lysol can and things like that.
It's interesting because if a person not aware, they giving their own opinions without the real
research,
research and a real official version of it, and they have this belief system, and he's a millennial, and I couldn't believe it.
Okay, so let me give. Okay, there we are. Audio disappeared for a minute. So I took this from the website. Again, this is www.cdph.ca.gov. And it talks about the coronavirus disease 2019, COVID-19. That's where they get the COVID-19. And they do have it in Spanish as well. It says California is issuing daily updates on the COVID-19. See the most recent update on the CDPH news release page. And at least you'll have the most guided facts and information. You'll also see all their news releases. It says state health and emergency officials announce the latest COVID facts. So we're going to click on that because we need to know the facts too. And we want to make sure the audience knows the facts as well. It does say a state health and emergency officials announce the latest COVID-19. This is as of March 15th, 2020. And I know some of us do not like to read.
Yes, they really like to watch the video, and they don't like to read, but you're giving them the actual facts from the site that's approved officially with the governor himself. So. And
this is the Office of Public Affairs, and so you'll see there's even a contact email, phone number that in case you're listening to this through one of our podcasts, Apple Podcast, and this will rebroadcast also on the Amazon channel. Mm-hmm. You can get us through Amazon Prime, so you can go back and look at these things back on TV. But anyways, the contact email is cdph, and you can go, well, that's really for the press, cdphpress@cdph.ca.gov, and the number 916-440-7259, and that's just if people want to have more up-to-date information. And if you don't have access to online information, they do have the contact number there that you can call. And this says the California Department of Public Health today announced the most recent statistics on COVID-19. California now has 335 confirmed cases. And again, this is as of March 15th, today, March 15th, 2020. And so today the governor and state officials provide an update on California's response. There have been 6 deaths, including 1 non-California resident. We got to talk about the deaths and the depth of the information that we're getting, because it's kind of sparse, and people are like, well, why are we? And I can understand why the conspiracy theories are happening, because people are like, well, it can't be that bad because I'm not sick. But here are the ages. This is important. Here we go. Ding, ding, ding. Everybody pay attention to this part. I need you to hear this. Listen carefully, because we've been hearing misinformation all day and all week long. I done heard from black folks that they can't get the COVID-19. Heard that because they are immune to it because they are black. I'm going to tell you, I don't think COVID-19 cares if you're black, white, brown, green, purple. Look at the ages there. Ages of all confirmed positive cases. Want me to read off the ages? You ready for this? Mm-hmm. You ready for this? Are you sure?
Yes.
Ages 0 to 17, 6 cases. Mm-hmm. Ages 18 to 64, 210 cases. Want me to read that age again? Ages 18 to 64, 210 cases.
That's quite a bit.
Yeah. And then age 65 plus is only 116. Unknown are 3 cases. So let me make sure you understand those ages again. The question
is, you said only 116.
I said only because ages 18 to 64 is 210 cases. Mm-hmm. And the misinformation is just flying all over the internet between emails and text messages. So I'd rather just let us get it straight, people. Let's get it right. So again, ages 0 to 17. That means we're talking about babies. We're talking about children. And those are 6 cases there. People might think that that's not a big deal, but let me help people keep this in perspective. Let's keep it in perspective. Before this all started, you had to pay to get the test. How many people are going to pay $1,400 to get the COVID-19 test?
I don't see too many doing that. I just don't see.
I don't know if people in the African American community can have just $1,400 just to
see-
pop
I
out.
don't see African Americans at all having that kind of money. Very rare, you might see.
Very
one.
rare, very rare. So myth number one, scratch it off your list that age doesn't matter. In fact, someone told us that it only happens to old people. Well, again, let me read those to you. You can see it on the screen if you're watching. And if you're not watching, if you're listening, it says 0 to 17, there's already 6 cases confirmed. And remember, these are either people that could afford the test or their insurance could afford the test at the time. President Donald Trump they just barely talked about the test being free. That was just announced over the weekend. So keep in mind that some people may be sick or carriers and do not know that they're carriers because why would they test if they don't even know that they're a carrier? And so ages 18 to 64, there's already 210 cases. It's age 65 is 116 cases. There's 24 it says 24 cases of positive tests related to federal to the flights. So some of the federal repatriation flights. 311 cases not related to those flights. Okay, so you have 70 that are related to travel, 68 person to person. So only 70 of those cases was related to travel. Remember what they were talking about? People were worried about traveling from China, northern Italy, by the way, who had the outbreak as well. That was so badly that Ken McCoy, one of our hosts here, entertainment hosts, he talked about how Tom Cruise, who was filming in northern Italy, I believe it was for Mission Impossible, they had to shut down the whole set.
Yes, that's interesting. And I was hearing also another person was saying even when Kobe Bryant funeral, people from China was trying to catch flights.
That was announced live.
Yes.
The newscasters said it. I don't even think they realized what they were saying.
Mm-hmm.
So during the live funeral, what they said was, there were some people from China, some dedicated fans that flew to Africa first, and then they were able to get into the United States.
Yes, they was
How
trying to
dedicated they are. I'm like, no. Dedication has nothing to do with this. We are more worried about, proximity.
Exactly.
I'm worried about,
And it was
forget
packed.
the dedication. Watch it on
thousands
TV
of
like
people.
everybody else did, live stream. But so at that time, the air restrictions were pretty loose.
Mm-hmm.
In fact, Whoopi Goldberg on the show that's in the morning, it's about 10 o'clock, it's called The View, she made a comment about her business partner. Her business partner flew from Italy. He self-quarantined himself. Nobody stopped him. This is the amidst of the crisis when people are finding out and they started doing the travel bans, and I think the president talked about some of the travel bans and so forth, and that they were on top of that.
So what are you saying? I'm just going to jump to the question. You saying to the audience and to us, you feel there's a lot more possibility of it than what is
This is what I know. I am not a doctor, nor do I claim to be, but I am a research journalist. That's what I am the queen of when it comes to research. Mm-hmm. I know, and so I started doing my research. I'm gonna share some text messages. My cousin in LA, he works at the UCLA hospital. And I'm going to read those text messages shortly. So what I'm saying to you is that a lot of things haven't been reported yet, and we're a little bit relaxed. I know coronavirus has been around for some time because some people have had it, meaning there are different strains.
Well, some people saying it's this 14-day thing. That's the amount of time that it takes to get out of your system. That's what someone was saying as another rumor. That's
well,
why
I'm not going to go off of rumors. I'm going to go off of this site that is the California Public Health. In fact, let me finish the cases that it was saying here. You need to know that 311 cases not related to the flights. First of all, there's 311 of those.
Okay.
And then I already talked about 70 was related to travel, 68 person to person. People should be worried about that. What peoples are you talking to? 82 are community transmission. That means nobody flew anywhere and somehow they got it, which means what some doctor friends of mine said, it means there's something that's airborne. Something is out of control in that sense. 91 under investigation.
What do you mean by airborne? Go into that. You say airborne?
I repeat, I'm not a doctor. I'm going off of what friends that are doctors, when you look at community transmission, that's always a concern. Because if a person was not in contact with anyone else that was in traveling or did not travel out of the area, that means they transmitted it from somewhere, which most likely is from a surface or the air. But being that this virus has been traveling mostly through cough, sneeze, that makes it airborne. That means it's airborne. And it says 11,700 plus number of people are self-monitoring who return to the U.S. through San Francisco or LAX. Want me to read that again? 11,700 plus, that means there's more, are doing self-monitoring who return to the U.S. through San Francisco or LAX. 11,000. Okay, mathematician, tell me about that number. Tell me how that affects us. How does that influence us? I mean, wow.
That's a lot of numbers.
Is it too many numbers?
That's quite a bit, because they come in from both areas, and most likely they will fly or either drive to Central Valley from either way.
Either direction.
Exactly.
So we're right in the middle. People that are just tuning in, you are listening to a special report, ONME News Review. My name is Julia Dudley Najieb, along with
Lennice, Najieb.
We were just going over the California Public Health website, which is the direct information. People should be getting their information in regards to any updates about the COVID-19 and restrictions and so forth in California. Looking at the CDC, what they're saying, 8 weeks is what they're suggesting of postponement and cancellation of events. That's nationwide. So going back to the numbers, it also says 49 is a number of local health jurisdictions involved in self-monitoring, 21 labs with test kits, 19 of which are already testing. So how can people protect themselves? And they go into that. Every person has a role to play, so much of protecting. The biggest thing is washing your hands. One story we had is about Stevie Wonder, the happy birthday to you, the happy birthday song.
Yes.
And if you hold your hands under the water, if you can go to ONME News, we have that, and you wash your hands for 20 seconds, it's equivalent to Stevie Wonder's happy birthday song.
So you just sing happy birthday to
okay, I guess you could sing like that. And so this is I guess this is unprecedented because it's affecting.
Well, we haven't seen anything like this, nowhere near the rate of panic until the early 1900s?
So in 1918, there was something called the Spanish flu, and we're going to put that on our ONME network channel. And the Spanish flu epidemic, oh gosh, they weren't traveling by planes in 1918. It was traveling by ports. So it spread so quickly because of all these ports. In fact, Vice did a documentary on that. People should watch that. I guess we'll put that. And at that time, the Spanish flu was said to have derived from a pig. It was known as a swine flu. And the reason why people should watch that documentary, maybe we should show some excerpts of it, is because it recycled itself and got stronger, a stronger strain. So when they thought they got rid of it, then there's a whole boatload of sick people that docked. And then those sick people were around other people. And the reason why it was so bad back then, they talked about the blood coming from the eyes, the nose, totally different. The strain got that bad, where people were dying within hours. Wow. So we're not saying that with this, though, with the coronavirus.
Can this mushroom to something else?
Again, I am not a doctor. All I can tell you is the research with the 1918 Spanish flu. People should look that up. And it knocked out millions of people when we're talking about the death toll and who was affected by that. And if people want to make some comments, you can call in or you can text us at area code 559-512-0766. And perhaps you're just listening. I probably would too, just to have some clear insight to what is what. And I wanted to go back over before we go over some of those cool facts I got from my cousin. I'll have to text her, and maybe she can call in. Now she may not want. I know because she works there, so I don't want her to have to lose a job or anything like that, telling me the information, but I'm glad she told me what's going on, and we're going to share that so people know why. This is definitely unprecedented, but I think we should be a little bit I think I'll just speak for the African American community, meaning the people that have been around us here in the Central Valley. They've been a little bit too nonchalant.
Mm-hmm. I agree.
And I mean, we've heard all kind of comments. You know, we've heard all kind of people say basically they're immune, they're not worried about an old people's disease. We've heard that, and but we're gonna look at these numbers to see how old of an old person's disease as people are claiming, so that we can either put that to rest, put that to bed, or maybe give some people some merit. I don't know. So anyway, going back to the site, let me pull that back up.
Well,
here.
you know, it's a lot that's going on out there. It's a lot of other theories. You know, people think this is some sort of government conspiracy theory or some sort of unbelief system, and they don't see the numbers don't make sense, amount of the death and the amount of the people that has been affected. So I was listening to somebody who was talking about that today, as they calculate the deaths that's in China, as it went into South America and also into America here, and it doesn't make sense to them.
So this isn't about making sense. One of the reasons why there's all these school closures, and we'll go through that as well, and why there's closures in general is to help prevent the spread of anymore. So they're not trying to get people to panic. First, I want to make sure I'm clear on that. Mm-hmm. But I do need to make sure people are aware of the numbers. No more misinformation. No more, oh, that's an old person's disease. I'm not going to get that.
Or a young person's disease.
Or a young person's disease. I'm not going to get that. No more saying that. Everyone needs to take the precaution. So Governor Newsom, let me go back to this California Public Health. Let me pull that back up so everyone can see that. And so it says here, Governor Newsom requested the legislature to make up to $20 million available for state government to respond to the spread of the COVID-19. And multiple state agencies and departments are helping the state prepare for the broader spread. We did see the doctor who said that inevitably there are more cases, they just haven't been reported on. California activated the State Operations Center to its highest level to coordinate response efforts across the state. 24 million more Californians are now eligible for free medically necessary COVID-19 testing. Remember I told you there was a cost before.
Mm-hmm. Yes.
Now it's free. So that's critical. That information is critical.
It's very critical because you can go and get tested free.
But that also means people weren't getting tested before if they were sick, mm-hmm. or if they felt they had a cold, or if it was really, or they just thought they really had a bad flu. Now they can go get tested, not worried about getting a bill in the mail. Because I know that's what our folks do. I'll get over this.
Yeah, I don't want no bill in the mail, so I just
take
some medicine. Or I just go.
I'm going to go take some of the
my system.
Robitussin,
yeah.
you know, some NyQuil and knock it out. Or people take a hot toddy. I'll just knock it out. That's what they say. I'm just going to knock it out, and it will knock you out if you're not if you're sick for that long of a period. And we're going to go over some of those, also the ailments that people should be aware of, not alarmed, aware. Awareness is the key, and that's going to be the key to making sure we keep everyone else safe. So it said California made available some of its emergency planning reserves of 21 million N95 filtering face piece masks for use in certain health care settings to ease shortages. Okay, so that's where that video comes in where the doctor talks about the mask and how the mask only helps you if you're sick. So if you know you're sick, or and it does, and I take that back, it does help people like if they're asthmatic or emphysema, so it will help.
Well, it doesn't help if somebody else, let's say you have the mask on your face and it covers your nose, your mouth, and it's around there. They want to make sure, from what they said, the coronavirus gets into your fingers if you don't wash your hands, and then you put your hands on your mouth and on your nose, and that's how you get that particular virus.
Okay, so what we learned when we were doing the fires, you know how we were at the press conference with all the ethnic media in regards to fires, and they talked about how everyone puts the mask on wrong. They would take the mask off, and then the PM 2.5 particles will get into the mask, and then they put it back on. That defeats the whole purpose. So being that this is airborne, it's the same concept, because people have to take the mask off, or they have to talk, or they get tired, of it being on their face. So essentially they're taking the mask off and then putting it down. And then what happens? That defeats the whole purpose. Unless you're going to keep that mask on all day, all night, 24 hours a day, 7 days a week, then it makes sense. It makes sense if you're already sick and you don't want to spread it to anyone else, which helps to contain your sneezing and your coughing. Unfortunately, you're sneezing, coughing in the mask. You want to toss that mask afterwards. But that's the key. It's the people who are already sick who should be masked. And I'm not trying to say have a hazmat suit, but at the same time, that's what's critical.
Well, a lot of people feel that by having a mask, that's another form of you not getting it, too, because it can block it. It can block the mask.
We're going to look up some information on that. I think the last thing I wanted to say from this site. That's
and also can help you prevent you from putting your hands to your nose and your mouth as well.
Well, maybe. I don't know. But the last thing I wanted to say from this site, again, this was last updated March 15, 2020. The California Department of Public Health State Laboratory in Richmond and 20 other public health department laboratories now have tests for the virus that caused the COVID-19. So 19 of them are currently conducting tests, with others coming online soon. That's the last from that site I wanted to give. So we're going to talk about these masks, right? So the mask, regarding you said you think that...
Yeah, the mask, what I think about the mask, like I said, people feel that having those masks on is going to protect them.
Mm-hmm.
That's why they go into the CVS. That's how they go into the Rite Aid. They rush into the Targets. They feel that this is another form of protection from the virus, the coronavirus. And we are dealing with, like they say, a crisis, because if the president and all the governors are shutting down everything, but that's crowded, that's a problem.
Yeah, maybe it is. So looking at the, but it's a bigger problem than we think, but there's only so much we can handle. So The Guardian reported on, can a face mask stop coronavirus? And this is from The Guardian newspaper, one of the California Bay Area newspapers. And it says, COVID-19 facts checked. The truth about how you can catch coronavirus, who is most vulnerable, and what you can do to avoid infection. And so, again, you can go to theguardian.com to look at this information yourself. Claim, face masks don't work. So it's not that they don't work, it's how you use them, again.
Is there different types of face masks?
There are different types of face masks also. There are. And so that's probably... So here's what they say. They said that wearing a face mask is not an ironclad guarantee that you won't get sick. Viruses can also transmit through the eyes, and tiny viral particles known as aerosols can penetrate mask. There you have it. Did you hear that?
Yeah.
It says, however, masks are effective at capturing droplets, which is a main transmission route of the coronavirus. And some studies have estimated roughly 5-fold protection versus no barrier alone, although others have found lower levels of effectiveness. So that's why I was saying if people are sick, it's better if they wear the mask, because they're protecting us. If they're sick and you don't know, and you don't want to go to the doctor, you don't want to pay that money, you're not too sure, but you don't feel well, wear the mask.
Yeah, but when I see a person wearing a mask, that's letting me know they're sick.
That's right. That's true.
So it's like, oh my God.
I was at a funeral, that was at the end of February. No, beginning of February. And a lady was wearing a mask. And I had to be up there speaking, and I was actually concerned because she had on a mask. And at that time, the COVID-19 had not alarmed the public yet, but she was wearing a mask. And so I was concerned, but I didn't want to ask her. And then she took the mask off to talk to people. So I'm like, that defeats the purpose.
So you think it was really going out all the way back in, I guess, local market?
Well, this
Fresno?
was I was at a funeral on that Sunday.
Which is the end of December?
Is in February.
January.
No, not that funeral. This was in February.
Okay.
A friend of ours that passed away. And she was wearing a mask, and then she went up to speak, took the mask off to speak at the podium, and then put the mask back on. And then after the service, she took the mask off to talk to people. That defeats the whole purpose of wearing a mask. I'm just saying, it defeats the whole purpose. Okay, so it goes on to say if you are likely to be in close contact with someone infected, a mask cuts the chance of the disease being passed on. Just like what I said, all the research that I found. However, masks will probably make little difference if you're just walking around town or taking a bus. So there is no need to bulk buy a huge supply. By the way, they are out of mask all over throughout websites. They're out of the mask and also the Purell, the hand sanitizer.
Okay.
That's what's maxed out, and I'm going to talk about that too. So many things to talk about. My gosh. And it says claim, is it mutating into a more deadly strain? That's the claim. All viruses accumulate mutations over time, and the virus that causes COVID-19 is no different. How widespread different strains of a virus become depends on natural selection. Oh, that natural selection. Mm-hmm. The versions that can propagate quickest and replicate effectively in the body will be the most successful. This doesn't necessarily mean most dangerous for people, though, as viruses that kill people rapidly or make them so sick that they are incapacitated may be less likely to be transmitted. So natural selection, I guess that means, yeah, you know, we've been warned about the strains and things like that.
Yeah, but they was also saying too that it can change strands. It can switch to something else. Right now, that's the unknown. That's the scary part. They were saying.
Well, true. It says the team behind this research suggested that this may indicate that, I think that's the L strain, is more aggressive, either transmitting more easily or replicating faster inside the body. So that's the same thing with the Spanish flu, that when we were watching the documentary of Spanish flu of 1918, the doctors couldn't even control the amount of beds, and also the nurses were getting sick, and the doctors were getting sick because that strain of that Spanish flu was replicating like crazy. And people were just dying in a matter of hours. So they want to prevent that because they know history from 102 years ago. They understand. Somebody has researched that history and understands that history and knows that history.
Well, they don't want to repeat that history.
Nobody wants to repeat that.
That was a horrible history to learn from. And now they're going into the steps to make sure that it's not repeated.
Check out this claim. Again, this is at theguardian.com, theguardian.com. Check it out. This claim, it is no more dangerous than winter flu. Here's what they say. Dun-dun-dun, drum roll. Many individuals who get coronavirus will experience nothing worse than seasonal flu symptoms. But the overall profile of the disease, including its mortality rate, looks more serious. So it's a mortality rate that's looking serious here. At the start of an outbreak, the apparent mortality rate can be an overestimate if a lot of mild cases are being missed. Remember I said how most people probably in the beginning weren't tested. They probably thought they had a cold or a bad flu.
Well, like I said,
or they just got sick and they're going to stay home.
Yeah, they just stayed home.
Or some people didn't stay home. Some people, you know how many people go to work sick?
You know how many people probably that had corona before coronavirus and your body with the different cells that was able to fight it off. You know, some people may be immune, some people may not.
So it continues on. It says this week the WHO experts suggested that, and that's the World Health Organization, experts suggested that this has not been the case with the COVID-19. Bruce Aylward, hope I said his name right, sorry, who led an international mission to China to learn about the virus and the country's response, said the evidence did not suggest that we were only seeing the tip of the iceberg. If borne out by further testing, this could mean that current estimates of a roughly 1% fatality rate are accurate. This would make COVID-19 about 10 times more deadly than seasonal flu. People needed to know that because we heard that too, huh? Yeah. Oh, it's just a cold. You can get over it. You know, I can be around somebody with that and I'll be all right.
Yes, a lot of people, some people just not worried. I'm not worried about this. This is something that I'm just not worried about, you know. And then they just go through the motions. And they feel that, I don't know why everybody's feel, I probably had the coronavirus probably 3 times in the last 3 or 4 years. You know,
But it's this strain, and it even said here that being it more deadly than the seasonal flu, which is estimated to kill between 290,000 and 650,000 people a year globally. So this is the research that we doing. I don't know if people want to, they probably want a break. I don't know if we should go to a break. They're probably like, why I got to hear all this, this craziness. I guess we'll take them into a break. Talking about the census, we want you to know how much more important that is to focus on versus just focusing on the virus. We want people to be aware of the virus, but we're not trying to make people paranoid from the virus.
We have to be counted.
Yeah. So the census is just as important. Let's take a look at what that hard to count is all about. So let's take a look.
The California 2020 census has modernized its approach to collecting data from residents throughout the state. In fact, the process has streamlined funding to reach traditionally hard-to-count populations missed in the last census in 2010, such as immigrants, low-income, LGBTQ, children ages 0 to 5, non-fluent English speakers, young and mobile, homeless and low-visibility housing, undocumented, and racial minorities. But it is duly noted that African Americans were undercounted by an estimated 800,000 people across the United States.
And so for our area of the state, our investment is really focusing on that hard-to-count population throughout the state. It's roughly a third of the state didn't do the census in 2020, right? So when we're talking about money, we're talking like some feria. We're talking about money, right? So what we want to do is, as a state, we want to invest really our efforts into getting that vulnerable populations to come out. And one, trust that their information is going to be confidential and safe. Two, that they're actually contacted by folks that are trusted messengers in their community.
The state has divided the census outreach into 10 different regions. Region 6 represents Central Valley counties Fresno, Inyo, Kern, Kings, and Tulare. The California Hard to Count Index is based on multiple demographic, housing, and socioeconomic variables correlated with an area being difficult to enumerate. Fresno County's percentile is 53, Kern 51, and Tulare 64, all considered to be rather high percentiles according to the median California HTC index of 37. These areas will pose significant challenges to enumerate for the 2020 census. The darkest shaded areas on the census index map indicate the highest hard-to-count regions in the 69 to 136 percentile. African Americans who reside in Tulare County are in the 73 to 95 HTC index. Kern County, 79 to 100 HTC index. Fresno County, 78 to 108 index. And the highest is Kings County with a 78 to 122 HCC index for African American residents.
Every 10 years, the task of California completing its part of our national population count is challenging enough. For starters, consider that more than 70% of Californians fall under some hard-to-count criteria based on income level, age, immigrant status, or some other category. And we recognize full well that there are multiple additional factors that will make the 2020 census an even bigger challenge. There is a significant lack of confidence in the federal government on the part of many of California's diverse communities. The underfunded and understaffed Census Bureau is now working hard to make up for years of the planning and preparation that did not take place in comparison to previous decades. The 2020 census will ask Americans to go online and submit their information electronically, while there still is a digital divide in America, both from an access standpoint and a literacy standpoint, and California is no exception.
The purpose of the census is to ensure fair representation of all individuals residing in California and that they are counted with no other strings attached. Although it is expected as a civic duty for those who live here, it also entails determining funding for much needed public services in specific communities, determines California's number of elected representatives, and redistricting if necessary. African Americans could benefit from funding of these services by simply being counted. The government would know which communities need change or fixing up the most and could provide opportunities for funding to these specific areas. In fact, based on the 2010 census data, 2 California cities benefited from federally funded CDBG program allocations to cities throughout the United States, and that was Salinas and Oakland. These 2 California cities were listed in the top 10 218 CDBG allocations. Another thing to note is that the Census Bureau will never ask for your Social Security number, bank account, or credit card numbers, or money and or donations. And they will never contact you on behalf of a political party.
And there will be a phone number available to the public if they feel that someone is contacting them that is not a census employee. But we will have a phone number in place where individuals can call to verify if the person at their door is a real census enumerator or not.
And that's the real on the African American hard to count in the Central Valley. And we are back. You're listening to or watching a special report, COVID-19. We are live right now, live broadcasting either through all of our social media outlets, on the website, Amazon Prime, Roku. You can watch all of this live. And we just felt it was important to get the message out and to help dispel a lot of that misinformation that's not only going on within our communities, but beyond. My name is Julia Dudley Najieb. I'm one of your hosts, along with
Lennice Najieb. Yeah, we are noticing a lot of rumors going around, and we want to dispel them. And we have a list that we come directly from the site. And Julia, what site?
Oh, you mean our site, or are you talking about the rumors?
The rumors.
Okay, so I recommend people actually go to the California Public Health to get all of the most recent information as far as the count of cases, which we went over earlier in the show, the first 30 minutes of the show. And right now I was reading from theguardian.com, helping to dispel some of the myths, because we've been hearing them all day, and that's when we finally, I mean, we were working on a totally different project. I was supposed to be working on something else right now, but we are a media outlet, and we needed to make sure we give people the right information. I think my last straw was the last phone call you had earlier today, and I'll just say it was to a younger family member, and they were not worried about it. They said, oh, it only happens to older people. I'm not worried about it. In fact, they said it only happens to people like us. I'm like, okay.
Well, you know, when I was talking to him, he wasn't making any sense. You know, when
talking to the mic so we can hear you.
When he wasn't making any sense, and
but there's a lot of people not making sense about some things.
He didn't seem concerned at all. He didn't want to I don't know if he was stacking up on waters or stacking on hand sanitizers or anything. He just seemed real nonchalant about it because he wasn't worried and had no fear or anything. Even if he had it, he said, well, if it spreads in 14 days, or you have 14 days to recover from it. That's why they have it 2 weeks. They did the research. Right now, in the whole valley, they said it's less than, what, 10, 20, 30 people? What's the chances of me getting with that? Well, we don't want it to spread. If it spread, it's just going to spread and spread and spread, because that's how powerful this particular disease is.
Yeah, it's the strain of the virus that we're concerned about, and so we were going over some of those myths, I suppose, some of those myths. And one of the other ones that I talked about earlier in the program, it only kills the elderly, so younger people can relax. You remember those numbers I read to you? And I said like 0 to 17 is this many.
Yes.
And then I said 18 to 64 was like 210 cases.
Mm-hmm.
And then I think it was 65 plus was 116 cases,
Yes.
is what I recall.
Yes.
Okay, so that already makes that claim a myth. That already makes it a myth. Ladies and gentlemen, you've got to pay attention. It only kills elderly people. So it says most people who are not elderly and do not have underlying health conditions will not become critically ill from COVID-19. But the illness still has a higher chance of leading to serious respiratory symptoms than seasonal flu. And there are other at-risk groups. Health workers, for instance, are more vulnerable because they are likely to have higher exposure to the virus. The actions that young, healthy people take, including reporting symptoms and following quarantine instructions, will have an important role in protecting. Well, here's my thing to that. So if you are 17 years old and you're an asthmatic, are you at risk? Yes.
Mm-hmm. Absolutely.
If you are 40 years old and you are healthy, are you at risk? Yes.
Yes.
So if you are 21 and you have a cold, are you at risk? Yes. So underlying elements can be whatever your pre-existing condition is, such as cancer patients, people with emphysema, people with other respiratory diseases and issues. Those are higher at risk, yes. But if you're already sick or have pneumonia, for instance, and you happen to be 19 and 21 and 22, and in that age bracket, don't think that you are not subject to this strain. The Spanish flu in 1918 did not look at age at all. Everybody died.
The way the people died with this particular strain, you know, they said it's like a pneumonia type of illness.
Mm-hmm.
It's like
It replicates fast in the lungs.
yeah, and what makes this particular coronavirus virus very challenging is it spreads fast. The method in which it spreads, and the method in which it spreads.
Its
is,
replication process is what?
It's airborne is one, and also the touch. That's why they said you got
Most importantly, we're still trying to get clarity on the airborne. But most importantly, it's the droplets. When people are coughing and sneezing and they're not covering their mouth, or if they do cover their mouth and that same hand is shaking another person's hand, you know, that's easily, that's another easy way for it to spread.
I remember we was walking, you saw somebody sneezing, and you want to go clear across the street. It was just mortifying.
I bet you're happy that I did make us go clear across the street.
Yeah, I am. You know, I'd rather be safe
Well, all
than
right
sorry.
then. All right. The name COVID or coronavirus comes from the crown-like shapes that are on the actual virus. This is what it looks like. I'm showing a picture on the screen for anyone who's listening.
It looks scary.
I don't like looking at it. I don't even like putting this on the screen. It makes
looks
me
a
itch
whole
right now.
bunch
I'm
of-
itching. My chest
Why
is
did
itching.
they have to put red?
Well, that's what it looks like. Okay, let me get another picture. I'll give you another picture, but that's what it looks like, little crowns on it. So that's why it's called the
It's like it's
coronavirus.
attacking the cells.
Oh,
It's
let me
like
just
a
take the
micro-
picture off the screen. I can't take it
It looked
anymore.
like it's smaller.
I
than
just
an
can't
atom.
take it. I can't take it. I can't look at it anymore. I gotta go.
It looks.
Made me
terrible.
cough. Cough to my own.
Please don't cough this way.
I'm way over here. I was trying to breathe and talk and swallow at the same time, and I was looking at that thing, and it just, I'm not putting the picture
And
up
now
anymore.
you start coughing. Huh?
Yeah, you see what I mean? Okay.
Now the audience is scared of you. This is not funny.
I'd be scared of myself,
People
so
looking at, well, this is not funny.
it's
You're
not
laughing and
funny. I'm
joking.
not laughing about that. I'm laughing at you, the demeanor and how you're doing anything. All right, so it says you need to be, now this is a claim, You need to be with an infected person for 10 minutes. Again, I'm reading from theguardian.com. Earlier, I was reading from the California Public Health site, which is where you should get your most, if you're wanting to know detailed information about anything that the governor, Governor Gavin Newsom, at least for California, or if you're listening to this nationwide and you are somewhere else, we recommend that you either go to the CDC site or, your disease control site, or you go to your public health website. And if you can't get to a website, there are numbers that you can call, and I'll see if I can pull those national numbers up. And if you don't have internet online, actually I wouldn't know how you'd be listening to us, but it says for flu, some hospital guidelines define exposure as being within 6 feet of an infected person who sneezes or coughs for 10 minutes or longer. However, it is possible to be infected with shorter interactions or even by picking the virus up from contaminated surfaces. Did you hear that? You can pick the virus up from contaminated surfaces.
No, I never heard.
Now you see why I didn't want to go to the restaurants.
Yes.
Okay.
And some people were saying, and I don't know, I think it's a bit racist. They said they don't eat at Chinese restaurants.
Well, here's the thing about that. Let's dispel that rumor.
Because they looked at it came from China, so they don't.
So then why is Northern Italy on lockdown? Northern Italy is on lockdown.
I don't know, but when I'm going by when they first heard it, they said it came from China, and it came from some kind of chickens in China over there that they was cutting.
Well, let's make sure we get so that it came from an animal, just like the swine flu, same thing, the 1918 Spanish flu. Mm-hmm. So a vaccine could be ready within a few months. Scientists were quick. Scientists were quick out of the gates in beginning development of a vaccine for the new coronavirus, helped by the early release of the genetic sequence by Chinese researchers. The development of a viable vaccine continues apace, with several teams now testing candidates in animal experiments. Poor animals. I never liked the testing on the animals, but.
Yeah, well, they're trying to save human
Yeah.
lives. And, when they was doing some sort of comparison, a lot of times they're looking at how many people could pass, if they didn't have it. Let's say for 100,000, 10% is, 10,000 that's going to be affected, and they're looking at that infection spreading, or whether it's 10 million, 10% is 1 million.
Right.
So that's pretty much a sum of the gravity or the effects that can possibly happen in like, for example, the United States, looking at those big numbers. And that's what they try to prevent, those big numbers of happening, because a number of people can be more or less terminated or very, very sick.
Again, 102 years ago, that Spanish flu is that I keep bringing that up because that was one of the largest pandemics. Because it spread so quickly just through docks. It wasn't even through airlines because there were none, 1918. It spread through people's contact, coming off a boat and just spreading that quickly, killing millions of people. And so according to this article, it says that there are several teams now testing candidates in animal experiments, but it's going to be a long time for a commercial vaccine to be rolled out. It's still a lengthy undertaking, so people need to know that it's not going to be right away. It's just not going to be right away. I don't know what to say about that.
And somebody was asking me, is the coronavirus a painful death? Is it a death by pneumonia?
Well, you can't breathe. So
it's no way. So even in the hospital, they try to help you breathe, and with all the machines and stuff, that won't help.
They don't have enough. Okay, so in some locations, there's not enough of the ventilation machines for breathing. But just like with pneumonia, there's only so much that they can do. They can't, if your lungs are filling up fast with fluid, you can try to make that person comfortable. And at one point, either the pneumonia is overtaking your lungs where they can no longer prevent the fluid from filling up in your lungs.
So it's kind of like a drowning effect.
Yeah, you just can't breathe. And the World Health Organization, I'm going to pull this up so people can see it. And I try to let people know of the sites that they can go to so that they can get the most accurate information is what I'm looking at.
And the World Health Organization shows the appropriate way to wear a mask for those of you who are concerned about having a mask. And there's even a video there, you see, that tells you how to wear the mask. And the WHO, they talk about that. So, and this is specifically dealing with the coronavirus disease and the advice for the public when and how to use the mask. So I do recommend that you go to www.who.int. And they do have information.
Have you have the audience call in? Do you know the call-in number?
Oh, where's the, let me see. Let me go back to that. I'll go back to that in just a moment. Let's see. When in use, do not touch the front of your mask. This is what I was just saying. Okay, so it says, while in use, do not touch the front of your mask. Before, it's in dark writing right here. I should have put the white background. It says, before putting on a mask, clean your hands. That's a big one. People are probably just rushing out the door, putting the mask on, not thinking that they should wash their hands.
Yeah, the corona could be on
any of the surfaces that you are. Well, no, not only that, it could already be on a surface that maybe you came in from outside and you touched something, or you set the mask down, or you touched the surface, and it's on the surface that maybe you touched, and yeah.
Yeah, so you're defeating the purpose again. So you got to always keep everything sanitized and wiped and Lysol and canned and everything else. People are so paranoid, they plan on staying inside the house.
That's not funny. You said it. You took 2 walks today, and I kept saying, are you really going to take that walk?
Oh, no.
And so when used, it does say to cover your mouth and nose with the mask and make sure there are no gaps between your face and the mask. All right? Avoid touching the mask while using it. If you do, clean your hands with alcohol-based hand rub or soap and water. Soap and water is what the doctors have been talking about is just as good. Sanitizer, okay, that's a fancy way of washing with alcohol. Because if you have the regular alcohol you get from the store.
One guy was telling me the other day is at least people going to start washing their hands when they use the restroom.
At restaurants and everything.
So they're going to be having some great habits coming out there from all this coronavirus.
So if you go to their site, they have how, and we probably need to put something on our site so that they have a link to this.
As well.
How to put on, use, take off, and dispose of the mask. That's important. You dispose of the mask. Don't just leave it. If you're done with the mask, don't leave it laying around. Okay? Because if there is some type of contagion on there, you want to actually put it in a plastic bag and throw it out. You don't want to just throw it in the regular trash can. Because, you know, some people will push down the trash to cover it, or to, if they're going to take the trash out. Nobody thinks about things like that. I guess I only think, I'm a germaphobe, so I think about things like that.
Oh, my goodness.
So it talks about when to use your mask. You can even download the information, and we'll put this on the ONME News website. And those of you who might have just tuned in, we've been doing a special report, extended report. Usually this is just a half an hour show. We started at 10 o'clock on the dot, maybe 9:59. And to give you a special report on the COVID-19, because there was so much misinformation out there. And I want to talk about the text messages from my cousin who works at the UCLA Medical Center. And these are the text messages I got tonight. And I want to know why that made you kind of shake in your boots, like, oh, no, this is serious. When she texts that.
When she texts that, well, she was talking about UCLA and they having those special type of tents. That's unheard of. Also...
Well, I guess we better tell them what she said. So my cousin who works at the medical center down there, has worked there for years, at least 20 plus years or so, says that for some of the problems she's having in LA, that she can't even buy toilet paper or water. They're out of both. We experienced that. And we're here in Fresno, Central California. And people are so basic and simple-minded, they don't think about other people. They're just thinking about themselves. So she said some people were grabbing like 6 packs, you know, of the
12-pack or like, the bigger packs.
Yeah,
So
well, they was occupying everything. They was making sure they got enough supplies.
yeah.
And the lines were so long. They had to be in line for about 30 minutes, some people 40 minutes, an hour, because it's a sheer panic.
Yeah.
It's a sheer panic.
So she goes on to say that UCLA has built an emergency tent in the parking lot. She said it's actually probably worse than what they are telling us. She is at the UCLA Medical Center saying they have built those tents. I think I saw something earlier, maybe it was on CNN or CBS, where they showed it briefly. I don't know if I can get some pictures of those tents. But that's a concern if she's saying that. Then she sent me, okay, that's about Africa. So then remember this is what is this? The NBA players, the basketball players, the Utah Jazz.
Yes.
And because there were a whole bunch of reports saying that black people can't get the coronavirus, that we're immune, and some ridiculousness.
We got the 2 NBA players.
Yeah.
That test positive.
Yeah.
For the coronavirus.
Yeah.
And and that's like
Donovan Mitchell.
That's the upper class of that. First one was tested positive,
and then the second one.
The second one. Now I know they.
This is
looking
Vince's
at the whole
desk.
team at this
Vince's
point.
work.
Sorry, the sound came on.
He's on a new project. It's a lot of late nights, early check-ins, even a few tears. Fortunately, his employer gave him plenty of time.
Sorry, that's what happens when you go live. Sometimes you can't. I couldn't control the commercial that was coming up. I was trying to read the article on the Donovan Mitchell, and he was the second NBA player that tested positive for the coronavirus. Oh, here it comes. Oh, maybe now, though. I was trying to wait for the commercial. Let's pull it back up.
NBA TV. I was watching Warriors and Raptors, and I was just, I was a little bit sad. I'm not going to lie. But it was a great series. It turned out really good. It was great. It was great.
All right, I'm going to take him off the audio because I think they switched stories on me. But for the most part, that there are 2 NBA players that tested positive for the coronavirus, and they happen to be black. So.
Well, that's unfortunate to not be aware of it, and people think, because they got money, because they got fame, that they're immune to it too. There's no immunity. If you're a human being,
boy, look at this
you have
story.
blood, you can get it too.
Well, okay, so then here's a report that confirms, and this is from the NBA. I don't think they would tell us stories about this. I think they're being legit about this information. It says coronavirus in the NBA. Child tests positive for COVID-19 after getting autographs at Jazz versus Celtics game. Isn't that interesting? That was a police chief says the young fan was at a Celtics Jazz game on March 6th. And this report was March 13th, 2020, 6:25 p.m. Eastern Standard Time.
That's scary, because just imagine
an autograph
get
you the COVID-19.
and
what
you
the heck?
Get that disease with thousands and thousands of people out there.
Yeah.
And that's the spread, and it spreads fast, and it's highly contagious.
Yeah.
So,
And this report of March 13th, it said, as of Friday afternoon, over 145,000 people had tested positive for the disease, and over 70,000 having recovered, and over 5,400 dead as a result of the coronavirus. That was, that was as of Friday afternoon. That was, again, March 13th. So that's pretty serious. I don't know if it's not more serious than that. Let me show a picture of what it looks like again. I know I said I wasn't going to show it, but I got to show it. That's what it looks like. And maybe if I show it, people start washing their hands, and people start being a little bit more serious, like, oh, crap.
I think people are washing their hands because you can't find no soap at the stores. You go to Walgreens, Walmart, and a number of other ones out there, and you can't find anything. They overbuying them. instead of one hand sanitizer, they want 10 of them.
Well, it just shows what would happen in an epidemic. Well, I guess this is an epidemic. This is a pandemic. My brother told me this is not an epidemic. This is a pandemic. Pandemic means worldwide. That's the difference. And because it's happening in different countries, South America, people don't hear. But we were watching the news in Spanish. Was that yesterday, Saturday?
Yes.
It's just, and luckily I can understand some of it. It's weird. The dialects here I can't understand, but if I'm back east, I can understand the Spanish dialect. Go figure. But anyways, it says Rudy Gobert apologized for his careless behavior before COVID-19 diagnosis. I hope my story serves as a warning and causes everyone to take this seriously. Oh, by the way, he's African American. For those of you who are saying African Americans or black people don't get COVID-19, he happens to be a black NBA player, and I don't think he's 40. Is he 40?
No.
Okay, so he's a young guy. Okay, you see what I mean?
Yes.
I guess he wasn't taking it seriously because remember we said how there's African Americans saying that, oh, this is a conspiracy and all those things. So he when he got up from the table, he started touching everybody's implements and instruments that are recording. I would have been hot if I was one of those journalists.
I would have been very.
Oh, I'd have been so. I probably would have. More things would have came out of my mouth that day because how dare you? But he apologized. But I'm like, you already put your coronavirus hands on my recording device, and I saw one of the reporters. He was going up there to the table to grab it before he was touching everything. He just kind of looked. He sat back. He didn't rush to go get his recording device. He just sat there.
So people think
I would have sat there too.
Even if you have coronavirus, not that you sneeze and cough, they feel that if they touch something and they positive, they can leave that mark of the disease on any item that they touch.
Well, here it says, Jazz star Donovan Mitchell has tested positive for the coronavirus. League sources tell ESPN Jazz players privately say that Rudy Gobert had been careless in the locker room, touching other players and their belongings. Ooh, that's so cold. Come on, people, let's be more responsible than that. Now a Jazz teammate has tested positive. So that's what we mean by being responsible. You see what I mean?
Yes.
For other people, it's a joke. It's not a joke.
So when they test positive, now they're susceptible to spread it even more.
Yes. And that's not, okay, so maybe Donovan won't get sick because maybe he doesn't have any pre-existing conditions.
And then if you test positive, also, if you test positive, meaning that the disease can go away in 14 days, possibly, if it's immune to it.
You keep talking about this 14 days.
Yeah, because that's what I read somewhere. And that's what some of the people also was telling me about this 14 days.
Okay. I don't speak on stuff unless I know. I don't. Okay. So I can give you an update on what this I don't know what that 14 days. You mean the quarantine period? I think that's what you're talking about.
The quarantine period. That's exactly what I'm
talking about. So the
quarantine
quarantine period, that's just when they monitor the health during the 14 period. That's all that is. So when they're telling you to quarantine yourself, like if you're coming from another country or you're coming from just traveling, period, they want you to self-quarantine at this point. Mm-hmm. And you want to do, I mean, look, Tom Hanks, he and his wife are have been tested positive, and they have the elements. And then we should go over the elements before we go off the air. But it says travelers from other countries, it's spreading. So it doesn't matter about China. Let's get the whole thing about China, because in Africa, in Kenya specifically, they're discriminating against a couple who happened to be Chinese who lived in Kenya, and people were bullying them in the street and chasing them down. Terrible, right?
Mm-hmm. Yes, absolutely terrible.
They were calling them coronavirus. They were calling them that. We don't want to do that, people, because the truth is it's not just a one type of folks that are bringing this stuff in and around where it's spreading. It's everyone. Everyone's susceptible, and anyone who is traveling is putting everyone else at risk. If they're asking you not to travel, can you please not do so? You know, we were supposed to travel somewhere. We're like, we're good. We're good.
Mm-hmm. I know I won't go nowhere. To be quarantined for 14 days and be trapped and just to see if it comes out of your system in that quarantine period of time, that's too big of an inconvenience. I know a lot of people refuse to travel by plane because of this virus, and they're just going to wait it out.
And nothing wrong with waiting it out, but there is something wrong if you're not being responsible for other people who might have, again, those pre-existing conditions. Somebody, if you are around somebody and you're sick and and they have cancer or they have asthma or they're already sick, you shouldn't be around them, especially if you've been traveling.
Yes.
So one of the things that the CDC, Centers for Disease Control, another site you should go to get accurate information, www.cdc.gov, coronavirus 2019. It gives you the background. And notice it's updated March 15th. That's today. So it's going to give you the most up-to-date information if you're not clear. It talks about the SARS-CoV-2. So the virus has been named SARS-CoV-2, and the disease it causes has been named coronavirus disease 2019, abbreviated COVID-19, just so you know what that means. And the CDC is responding. It's an outbreak. It's of a respiratory disease caused by a novel, which means new, coronavirus that was first detected in China. Detected. That doesn't mean it wasn't anywhere else. It just happened to be detected in China. Now, one of our friends in South America said, as it was already detected in China, they were already seeing cases in South America. He's in South America and was able to respond to my brother through text, through the WhatsApp app, and said, how is that possible that in South America they have cases at the same time China has cases, but they weren't reporting on that in South America yet?
Now, I don't know how that's possible. That's impossible, in fact.
No, nothing's impossible.
But, to have those kind of numbers happening in South America and before China are...
Yes, it just wasn't reported on.
Yes.
So the key word is they said it was detected in China.
Well, from what I researched and from what I read and from what I saw, even China was trying to keep it at a low lid and not being transparent. And they said they was saying that with the debate earlier with Joe Biden and Bernie Sanders, that they wasn't being as transparent. Had they had a little bit more transparent, we all could have prevented from going and being such a widespread epidemic.
So at the CDC, on the CDC.gov site, it tells you the source and spread of the virus. It talks about how it's a large family of viruses that are common in people. That's why people say, oh, it's just a common cold. It's okay. Mm-hmm. But really, there are many different species of animals, including camels, cattle, cats. They go into this. Rarely, animal coronavirus can infect people and then spread between people, such as with the MERS, the SARS. Remember those?
Yes.
And but that's ironic they say that because in 1918, the Spanish flu supposedly came from the swine flu. That's why it was also called swine flu. So early on in many of the patients at the epicenter of the outbreak in Wuhan, this is in China, had some link to a large seafood and live animal market. So that's where they detected it. I want to make sure I'm clear. Detected it. And then it goes on to say that they're indicating person-to-person spread, exposure to animal in the markets didn't help. And it was also reported outside of in countries outside of China. So that tells you that it is person-to-person spread according to the CDC, who has it on their site. And so it spread with these animals that had the COVID-19. It's also spread into parts of the United States, so you can read more about that, the confirmed cases. Severity, again, this is CDC. They're trying to give you pretty much the severity of the situation. And it says reported illnesses have ranged from a mild, including some with reported symptoms, to severe, including illness resulting in death. It goes on to say that out of China suggests serious illness occurs in 16% of the cases. Older people and people of all ages with severe chronic medical conditions. Remember I was talking about that? Yeah. So that means all ages. It doesn't mean it's elderly people's disease. So stop it. Stop saying that. Whoever's saying that, no more. Don't say that anymore. If you have a chronic medical condition, it doesn't help. So if you have heart disease, lung disease, diabetes, those are all chronic conditions. And you're at that means you're in the high risk bracket. You should actually be more aware of what's around you, what you're touching your hands on. If you cough, even if you're not sick, you just, cough with your hand like that. You want to have sanitizer, maybe a little bottle of sanitizer at all times. And the thing about the sanitizer, I'm going to get into that too before we get off the air here in about 15 minutes or so. You can still, even rubbing alcohol has the same tenacity as the hand sanitizer, if not better.
Well, they have different types. They putting a little extra on it, where one of them said this is a severe or extra strong hand sanitizer to make you feel more secure, so you can purchase that one. Some people are going high up on the hand sanitizers. Imagine,
oh my God, like $58 for a bottle. Ridiculous.
I saw one at $75. You know, and if people are going on Facebook asking for the thermometers and stuff like that, so they doing whatever they can in their mind to feel that they trying to be safe and trying to be protected and trying to survive this so-called outbreak until we get an understanding or control over it. So that's some of the high risk that's going out there for those that always checking their temperature, and they checking it everywhere they go, because that's a sign of them getting it. They feel.
So the World Health Organization characterized this as a pandemic on March 11th. And it says this is the first pandemic known to be caused by the emergence of a new coronavirus. In the past century, there have been 4 pandemics caused by the emergence of novel influenza viruses. As a result, most research and guidance around pandemics is specific to influenza, but the same premises can be applied to the current COVID-19 pandemic. So pandemics of respiratory diseases follow a certain progression outlined in a pandemic intervals framework. Pandemics begin with an investigation phase, followed by a recognition, initiation, and acceleration phases. So they have a whole framework you can click on, the World Health, CDC.gov. This is where we're getting, well, this is where I'm reading from. I should put it on the screen so you can see it for yourself. It's saying that. It says, during which there is a decrease in illness. And so we're going to see some phases of this. This isn't quite over yet. It says different countries can be in different phases of the epidemic, just like China is in different phases of the epidemic. And then they talked about a new strain in China. So I'm like, what? At any point in the time in different parts of the same country can also be different phases of the pandemic. So even here, where we're located in the Central Valley, we're in a different phase than the rest of California. And if you look at what's happening in Washington, they're in a different phase. They're definitely in a crisis mode. So it says situation in the U.S., it says different parts of the country are seeing different levels of the COVID-19. That's why we said not to take this very lightly. And it says the United States nationally is currently in the initiation phases, but states where community spread is occurring are in the acceleration phase. Remember, community spread, that means individuals didn't travel nowhere and they still got it. Community spread. The duration and severity of each phase can vary depending on the characteristics. So risk assessment, they go into all of the risk assessment, risk of exposure. The immediate risk of being exposed to this virus is still low for most Americans, but as the outbreak expands, the risk will increase, and that's what we're seeing is an increase in exposure. People in places where ongoing community spread of the virus that causes the COVID-19. So now that brings us to like the CDC recommending 8 weeks canceling and postponing events. And then the governor at first said people of 250 people or less, you can have events. And now it's like, hey, postpone everything. Then it went down, it dropped to 50 people or less. But here's the thing, if there's just one person in that group, that one person can spread it to all 50 people.
Yes, it's getting more serious, from 250 to 150 to
50
to just don't go.
Yeah. And, you know, they even have who's getting sick and look at coronavirus by age, gender, more. I just don't think people should go by the age. Oh, I'm too young, I can't get that.
Well, people shouldn't go by, not only that, they're looking at older and younger are and that kind of thing. But no, they shouldn't go by that. And it's acceptable for everybody.
Right, right. And there's something, I think we already talked about the sanitation. That video, I think it's on our website. I'll have to go to that video because I don't think we're going to have time to really play that. And what were the other things? Did we go over the symptoms? I think we went over that, the cough. And,
yes.
But the symptoms can range from having a fever to a cough to even a sore throat, by the way, because it will act like flu symptoms. My dad sent us something. Stanford, he sent that rather early. Do you remember what that was? He sent it from Stanford University.
Yes, it's in my email, and yes, it's a crisis there where they just cancel all classes and had everybody just do it online. In fact, most of the schools, not just at Stanford, Fresno State, and so forth, are doing all their classes online. And here it is right here.
You found it?
Yeah.
That's what I was looking for. That was it a email? Maybe you can see Stanford, and because they were the first to start counseling before everybody else did.
So the information provided is to show you how serious the coronavirus situation has become. You need to consider this impact in any planning that you do or propose to do.
It's coming from an alumnus of Stanford. My dad is.
So,
alumnus of Stanford.
Dear Stanford alum, I am reaching out to share an update on Stanford response to the COVID-19 coronavirus situation. University update regarding spring quarters. In response to the virus threat and supporting efforts to curtail its transmission, this afternoon the university communicated that the undergrad students should not return to campus.
So what was the date on that? You said, what was the date on that?
On March 10th.
And when did my dad send that? He sent that to me. He sent it to everybody in the family, actually. Yeah. And so he's an alumnus, and they sent that to all the alumni. And here's what Stanford is doing. They're doing a drive-through coronavirus testing that's available by appointment at the Stanford Healthcare Center. I can tell you they're doing that, drive-through appointments.
Yeah. And so you see Stanford, you see all the casinos, you see a lot of the place where there's gatherings, restaurants.
Well, the MGM Las Vegas has shut a lot of their hotels down. Let me see if I can find that. There was an article on that as well. MGM, the resort. Oh, here it is, and that was March 11th. But this is recent, 5 hours ago. MGM and Wynn to close this is coming from Fox 5 local Las Vegas. Let's see if I can pull it up so people can see that. And when you see casinos start shutting down, that's a problem because they like money.
Mm-hmm.
They like them some money. It's not about. Oh, let's see. There it is. Yeah, there. Let me pull it back up. Oh, there it goes. So MGM and Wynn to close Las Vegas resorts and amid the pandemic. There it is.
Yeah.
Welcome to fabulous Las
that's
Vegas.
Something. That's so many millions. Just imagine all the employees, all the teachers, their salaries, the students, what they're learning. All that revenue. How they're going to replace that, and how the country can recover from that. The stock markets is a bear's market going all the way down.
We'll have to talk about that tomorrow. There's not enough time in the show.
Yes.
But so Las Vegas, MGM Resorts and Wynn Resorts announced Sunday their properties in Las Vegas would be temporarily closed as a part of an effort to stop the spread of the coronavirus. So I want people to understand that the pandemic, they're trying to help stop the spread. So that's serious to them. If a casino is going to be shutting down for a minute, that's a big deal. Shutting down one day. How many millions of dollars are they losing when they shut down one day?
Oh, they're losing billions of dollars.
Let me show people.
All the casinos combined, billions and billions of dollars.
I'm thinking if I keep showing this picture of this coronavirus, people will take it more seriously and be like, oh, okay, maybe I should go wash my hands now. No, I'm sure people, I take a benefit of it. I think they do wash their hands.
No, some people don't. You know, I'm just being honest with you. Some people go use the restroom and walk out of there.
You're not supposed to say that out
without
loud. Don't say
Well,
it. And which restaurant have you seen that at? So I know not to. Well, I don't like
it's-
going to too many
well,
restaurants anyway.
Well, you never know who does that. But right now, I think it's more of a panic that everybody washing their hands because they scared they're going to get it or they're going to put it on themselves. It's self-preservation right now.
Well, self-preservation is going to help everyone else. So if everyone is at least mindful of the situation and mindful of washing their hands and mindful of, oh, I do have a cough, I'm not going to go into work today. But you know what? A lot of people didn't go to work and have been laid off. If you look at even baseball seasons coming up, you have a lot of people laid off because schools have shut down to help prevent the spread, not because there's anything that they found at the schools, but they want to do a thorough cleaning. I know locally in the Central Valley, like Fresno Unified, Central Unified, I believe, is close to the 20th. Fresno Unified has, I think, until the 13th. And so there's a mixture of spring break with that, so I think that's really smart that they did that. You know who else is taking a big hit that I'm surprised I haven't heard you say anything about, especially being a numbers person? Stock market.
Oh, yeah, that's what I was just talking about earlier. It took a dive.
Oh, I must have missed that. Well,
Yeah,
let me
with the
throw that on the screen so I can see that.
With the bear,
Oh, there it
yeah,
is.
It's a bear market. It's a dive. United States.
So
all
what does
over
a
the
bear
world.
market mean? What does that mean?
That means that the graphs is going down, that the market is
Look,
going down.
there's a picture of the bear. I don't know if people can see.
It's going down, 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 down.
Down. Okay.
So people are losing money.
Okay.
All over.
But
some
you also
people-
said people are getting money.
Some people are betting against the market, but you know, just imagine the people that already have their money in the market, and they rushing to take their money out of this panic, you know. So the panic of them trying to get their money out, the panic of the market is going down into a bear's market.
So that's why you have
all
that bear. Rawr. And this article is March 16th, 2020, so Eastern Standard Time, of course. Stock market hit by coronavirus, reasons for turmoil, what equity investors should do now. So you might want to check into that because some people are making money during this time, but believe it or not. Mm-hmm. It says in just weeks, the coronavirus pandemic has shaved off nearly a third of the global market cap. The Indian equity market bounced back valiantly on Friday, but the Sensex still closed at 20% below the peak. Is that a lot?
Mm-hmm.
Okay. And
Yes, it is.
achieved 2 months ago. Investors can get some cold comfort that more markets have fallen more. The spread of the virus has triggered panic across the world and shaken the confidence of investors. I guess that's expected. That's nothing new in that sense.
Mm-hmm.
There's nothing new under the sun with that. So I know we got the pandemic and stuff going on, and we'll have probably end up doing a part 2 probably tomorrow evening, probably about the same time, 10 o'clock. But before we leave, folks, I want to make sure we're able to talk about the importance of the census. And you should have, even amidst of all this stuff happening and going on, people should have gotten something in the mail. It was sent out on the March 12th. And I want to encourage people to make sure they fill out the census. Please make sure you count and to be counted, and everyone in your household is counted. There's nothing to worry about as far as the government coming knocking on your door. We've heard all kind of things at the town hall meetings, and we've heard the fears. We understand the fears. We've talked about it, and we're telling you there's ways for us to get past that. As long as we talk about it and talk it out, and we have an understanding that, yes, that is what history did do if we're looking at African Americans and so forth. But what I'm telling you in 2020 is that is not today's history, meaning Governor Gavin Newsom and the rest of the United States wants to make sure everyone is counted. Whether you're African American, Chicano, Latino, or whatever you are in your cultural background, it is important that you're counted so that we can make sure funds come to the community and also service your community. That's what's most important. So you'll see the census. How about this? If you don't fill it out, you have people knocking at your door. And I know you're worried about people knocking at your door with the recent coronavirus outbreak.
I would like that. Nobody knocking on the door. You
Can
know,
that be
they won't
at
be
my
getting
door?
in. I'm looking at them, and good thing, no.
So if you want to avoid that, not only can you access that online, and you'll see the commercial when we're leaving so that we can give you more information about it, but for the California census, you can always go to californiacensus.org. And that's, I figure you're online listening to this, and if not, if you're watching this, because we do have our USB TV that some of you still have, or some of you still have the USB tablets. And if you're not able to click on the website or anything like that, know that you can not only go to californiacensus.org, but you can also learn more about the census and actually call in, and they can instruct you. They won't fill the census out for you. I want to make sure I'm clear on that. They will instruct you and walk you through it. And especially if it's a mailer that you got that's telling you to go online, and I know our population that's 60 plus, they are having some concerns about that. You can actually call in and they'll walk it through with you. We even have a local line that you can call, but the main office that you can call from 8 a.m. to 5 p.m. is 916-852-2020. See how easy that is? 916-852-2020. And I think that's what I wanted to let people know in regards to the census. Anything else we want to let people know about? I know we did a longer extended special show.
We covered a lot.
Yeah.
So
and there's probably more to come, and we'll probably do some more breaking news and maybe have some doctors and some other folks to call in. We just wanted to get the information straight because we heard so many things today. I'm like, oh, this is outrageous, especially the one about I'm too young to get it. I've heard that. I heard someone talk about how it's not going to affect them. It's the government just lying and putting it out there to scare people. But I don't think the government is into businesses losing money or into people being laid off.
Well, that's what I shared to them then. That's billions and billions of dollars.
Billions of dollars.
They're not into that kind of play.
Yeah, I don't think that. And now it might be somebody else. I'm not going to say our government. You never know. It could be something else. But that'll have to be for another time. And I only talk about things like that unless I have my research to prove it and know it. So at any rate, we hope that you stay safe. If you don't have hand sanitizer, again, if you do have a bottle of alcohol in your house where you can even mix it with that lotion, it's really about the alcohol content that is in there so you can keep your hands clean. Others of you who are going to the store and panic, again, we don't want you to panic from the pandemic. We want you to be aware and be safe. And I'm sure our other podcast hosts will also be talking about this and some other things in the census because all those things are important. We thank you for tuning into this special ONME News Review report, breaking news, on special report on the COVID-19. And we hope that you are able to take this information and pass it on. I guess that's what I could say. Any last words you want to say, final comments?
Yes, be safe, be careful, and wash your hands.
And don't eat out at restaurants for a while, or if you are, just be mindful. And don't discriminate. That's another thing. I don't want people discriminating and just assuming that Asian people or individuals coming from China are the only ones infected. Again, I mentioned South America. They're in a pandemic phase as well. There's other parts of the entire world that are Africa. It just hit Africa. I still have to check the validity of the weather as to why Africa wasn't hit as hard. I've been told that it's the warmth of the weather. I need to find the research on that before I even pull up articles and say, yes, that is what it is, folks. But until then, we thank you for watching. This is a special report edition of ONME News Review. And I don't know how to do this phone right. If you were trying to call in, I do apologize. We were just trying to hook everything up, and this is live, y'all. This is live. Thank you for tuning in. Have a great night. Wash your hands. Go to bed. Wake up in the morning. Get dressed. And live life. Enjoy life. Have a good one. Have a great week, folks.
brought to you by.
Did you know that the U.S. Constitution requires the government to count everyone living in the United States every 10 years? That our representation in Congress is determined by each of us showing up for our communities by counting ourselves? That this count determines funding allocations for programs we rely on, like school lunch, Head Start, healthcare, and housing assistance for the next 10 years? An undercount means less money from the federal government for vital services we use every day. It only takes a few minutes to complete. You can be counted online, over the phone, or by mail. Invitations to participate will be mailed in March. Make sure you and everyone in your household are counted. Our future depends on it. For more information, visit californiacensus.org.